What does it take to become an industry leader? At Mada, we understand that the hard truth with every patient you see is that they hate needles. That's why the Madajet needle-free injection system is the only real solution that can offset the apprehension associated with a needle.
I find that the Madajet is extremely useful in almost every area of my practice. I use it whenever I need to do any palatal injections prior to needle insertion. I use it for mandibular injections prior to giving inferior alveolar blocks. I use it most of the time when I do root planing and scaling on periodontal patients instead of giving them full anesthesia. I find that I could not practice without the Madajet.
One of the most common procedures for the use of the Madajet XL is for mandibular infiltrations prior to deep needle insertion for producing a mandibular block. The technique for this is to make 2 injections. The first at the point where the needle insertion is to be made, and the second is slightly posteriorly to the first injection. The reasons for these 2 Madajet XL injections are as follows. A. The first injection completely anesthetizes the sensory epithelial tissue so that the insertion of the needle is not felt by the patient. B. The second injection by the Madajet XL reduces the pain caused by the amount of anesthetic fluid pressing against the nerve tissue during the needle injection. When this is done properly, the patient response during the needle insertion is tremendously diminished. There is no doubt that injections into the palatal areas are notoriously the most painful in dentistry. It is often said that when God made the palate, He never designed it for the dentist. The technique for areas of the incisor foramen is to make 2 injections lateral and on each side of the papilla, which is immediately over the foramen. When the anteriors are to be worked on, an injection into the labial aspects of the anteriors at the interradicular areas can be made. Profound anesthesia of the anteriors will be realized from this procedure, and this can be followed by needle insertion when required. The posterior palatal foramen can be handled easily by making 1 or 2 Madajet XL injections in line with the pattern of needle insertion. The usual discomfort and anxiety is almost entirely eliminated with these procedures. Perhaps the greatest proof of the effectiveness of the Madajet XL can be experienced by the dentist and the patient with these procedures.
Well, with the needle, you feel that prick, you feel it, going in. With that second, this year I didn't feel nothing.
In 1969, the Madajet was first introduced to the dental and medical market. Since Mada had the distinct advantage of observing the weakness and mechanical failures of other jet-like products, it resulted in an advanced and unique system that is second to none. The basic concept was derived from a portion of the fuel jet injection system commonly used in diesel engines. Fuel is forced under pressure through an orifice, thus producing a fine jet stream, and then a resulting mist, which is significantly more efficient. The Madajet fits in your hand like a syringe. With a maximum loading of up to 4.0 cc's, the Madajet permits approximately 38 injections. The Madajet offers a consistent volume of 0.1 cc per injection intradermally. All common sterilization methods, except dry heat, can be utilized. The operation of the Madajet is as easy as can be. Since it's a closed system and needle-free, fluid can only come out of the Madajet, and nothing can enter the head assembly or fill chamber. Operation is begun by cocking the lever. This raises the piston from its resting place in the head assembly to an exact distance and locks into place. The local anesthetics in the fill chamber run down into the head assembly in front of the distal end of the piston. Since gravity is a key element, always cock the Madajet nose down. When the release button is pressed, it frees the piston to move downward and compresses the fluid, driving it at 1,800 pounds per square inch through the jet washer orifice, forming a needle of solution. Absorption of the anesthetic is fast and greater because the fluid does not have a chance to pool as it does in a needle injection. The single 1/10 cc of anesthetics injected generally lasts 30 minutes. Also note the fine wheel made with the Madajet, which is the anatomical site for deep needle insertion when required. However, the most interesting fact about the Madajet was the onset of anesthesia was virtually instantaneous. After you have prepared the Madajet, filled it and primed it and placed it into the Madajet holder, you can now briefly explain the Madajet to the patient. This is done by cocking and firing it at the palm of your hand, held 10 to 12 inches from the Madajet. You say to the patient, "See, no needle. I'm going to spray your gum." This gives the patient the chance to see and hear the slight firing sound of the Madajet. You'll see that a new peace of mind has been established. Then, place the Madajet with sheath gently against the specific area to be injected, so that it is firmly contacting the mucosa and perpendicular to the tissue. Stretching the mucosa is not recommended. This will allow the injections to be directed towards the underlying bony structures. The depth of penetration is 2 to 2.5 millimeters below the epithelium and forms a wheel at the base of the injection of approximately 6 millimeters in diameter. Inject into the interradicular area at the periapical level towards underlying bony structure, not into the fold. You can inject anteriorly, posteriorly, as well as lingually to the tooth.
The Madajet felt just like someone just took their finger and just flicked my gum. It didn't hurt at all. And the needle, it really felt like something was going in, and felt like a sharp pain.
As you can see, the Madajet is a truly unique injection device that will provide the physician and patient a method of reducing fear and psychological trauma associated with the traditional needle syringe injections, and at the same time, allowing smaller doses of anesthetics to be used. It is not important whether the Madajet hurts more or less than the needle. The fact is, there is no needle. Patients hate needles.